Voice of America. Special English. This is the VOA Special English Help Report. The United Nations is seeking to improve electronic communication for health workers in Africa. Workers in rural areas would have a better way to get training, information and advice from doctors hundreds of or even thousands of kilometers away. In 2005, the World Health Assembly placed a resolution urging countries to plan for e-health services. The idea is to look for ways to use modern information and communication technologies to strengthen health systems. The World Health Organization says Africa is behind other parts of the world in treating HIV, AIDS, tuberculosis and malaria. So the United Nations Economic and Social Council is supporting the expansion of telecommunications technology for healthcare workers. Telemedicine is another term for e-health. Steinar Petersen is the director of the Norwegian Center for Telemedicine and the Mediuniversal Hospital of North Norway. Dr. Pedersen is working with the WHO. He recently met with West African health officials in the general capital, Accra. He says that technology can provide easier access to medical specialists and make it easier for people to seek medical information themselves. Elias Sori is the Director General of Health Services in Ghana. He says e-health will offer a way to reduce the effects of health workers' charges and make it easier to train existing workers. Dr. Sori says the technologies will also make it easier for doctors at Ghana's main teaching hospital to share their knowledge. Dr. Sori said this would help doctors in villages with difficult cases. They would be able to link up easily with a top doctor in the hospital to get advice. He also said so there is always new medical information, but it is not necessary for all doctors to go to the teaching hospital to be trained and increases their knowledge. He said e-health can bridge that gap, and medical education is one of the most important parts of e-health. Services might be shaped to fit each country's healthcare needs and level of technological development. Another issue is patient privacy. The hope is that health ministries will together develop policies and collecting and storing electronic health information about individuals. And that's the VOA Special English Health Reporter. Transcript and MP3s and archives of our reports can be found on the voaspecialenglish.com, when you can also post comments.